Oral Rehydration Therapy, Introduction. Which of the following is a sign of severe dehydration? Choose one of the following options. 1. Rapid pulse. 2. Fast breathing. 3. Weak muscles. 4. All of the above. Correct. Signs of severe dehydration include rapid weak pulse, fast deep breathing, fever, and weak and floppy muscles. In case of severe dehydration, which of the following is best to rehydrate? Choose one of the following options. 1. Food. 2. Plain water. 3. Rehydration drink. Correct. Rehydration drink provides the water, salts, and sugars the body needs to recover from severe dehydration. After you give liquids, you can give food if the child accepts it. The main advantage of the home-prepared rehydration drink over the one sold by the pharmacy is that it's cheaper. Select true or false.
Correct. Treating severe dehydration right away is important. Prepare the special rehydration drink for your child without waiting to go to the pharmacy or grocery store, especially if the store is not near your home.
You should give the rehydration drink to the child every 5 minutes. Select true or false.
Correct. Offer the rehydration drink every 5 minutes throughout the day and also at night. This is essential until urination becomes normal again.
If the child vomits, you should stop giving him or her the rehydration drink. Select true or false.
Correct. If the child vomits, don't stop giving frequent sips of the drink. Some of it will be absorbed by the body.
Thank you for using Explain.